Bismillahirrahmanirrahim. Today we are going to discuss the topic. Before this, we start discussion. See these two photographs. This photograph is giving you some of the information regarding this topic to be discussed later on. You can see that this patient is an old man sleeping and sitting on a bench. He is also obese as well. See this photograph as well. This photograph is also giving you some of the information. You can see that the male person is sleeping with open mouth, and the female, on the other hand, is seeming to be very much annoyed due to the noise produced by the sleeping man. She cannot sleep properly. So these two photographs giving you some of the information which is giving you hint regarding the topic to be discussed. That is, we are going to discuss obstructive sleep apnea syndrome. We will discuss this topic under definition, etiology, sites of snoring, pathology, clinical features, consequences, diagnosis, and then treatment. First of all, definition of obstructive sleep apnea syndrome. Obstructive sleep apnea syndrome is a clinical condition characterized by snoring and cessation of breathing lasting for 10 seconds or more during sleep. There is another heading, snoring. Snoring is an undesirable disturbing sound occurring during the sleep. And what is sleep apnea? Sleep apnea is cessation of breathing lasting for 10 seconds or more during sleep. Less than 5 such episodes is considered to be normal. What is apnea index? Apnea index is the number of episodes of apnea in 1 hour sleep. What is hypopnea? It is the reduction of airflow by 50% from the baseline associated with an EEG-based arousal, or 4% drop in oxygen saturation. There is another term that is called a respiratory disturbance index. This is also named as apnea or hypopnea index. It is the number of apnea or hypopnea events occurring in 1 hour. Normally, it is less than 5. Classification of apnea. On the basis of respiratory disturbance index, the severity of apnea can be classified into mild, moderate, and severe apnea. Mild apnea is when respiratory disturbance index is 5 to 14 apnea per hour, whereas it is moderate when respiratory disturbance index is 15 to 30, and we will call apnea as severe apnea when respiratory disturbance index is more than 30 apnea per hour. And what is sleep apnea? There is no breathing at all at the level of nose and mouth during sleep. In that case, we will call it as sleep apnea. Types of sleep apnea. It can be divided into 3 types: obstructive, central, and mixed type. In obstructive sleep apnea, there is collapse of the upper airways resulting in cessation of airflow. In this way, the defect lies in the upper respiratory tract. In central sleep apnea, the airways is patent, but brain itself fails to signal the muscles to breathe. So the fault is at brain level, while upper respiratory tract is normal. And in mixed apnea, it is combination of both types. So both the upper respiratory tract and the brain are defective. Now we will discuss the obstructive sleep apnea syndrome in details. Obstructive sleep apnea. In this case, there is collapse of the upper airways resulting in cessation of airflow. Etiology. The cause may be seen at different levels of upper respiratory tract. The cause may be in the nose, the cause may be in the nasopharynx, it may be at the level of oropharynx, oral cavity, and it may be in the hypopharynx and larynx. First, the causes in the nose. The cause of obstructive sleep apnea syndrome in the nose may be deflected nasal septum. It may be hypertrophy of the turbinates, nasal polyps, nasal tumors. In the nasopharynx, the causes are adenoids and tumors of the nasopharynx. In oral cavity and oropharynx, the different causes may be macroglossia, tumors of the tongue, elongated uvula and soft palate, hypertrophy of the palatine tonsils, and retrogranthia. In the hypopharynx and larynx, the different causes may be omega-shaped epiglottis, tumors of the hypopharynx, laryngeal tumors, and laryngeal stenosis. Miscellaneous causes. In miscellaneous causes, we can consider the male gender because it has been seen that obstructive sleep apnea syndrome is more common in males as compared to the females. The incidence is 25% in males and 15% in females. The second factor is the age above 40 years. Then obesity, thick neck with collar size more than 42 centimeters. Use of alcohol and use of sedatives and hypnotics. All these causes may be grouped under miscellaneous causes which may lead to obstructive sleep apnea syndrome. Sites of snoring. The usual sites of snoring are soft palate, tonsillar pillars, hypopharynx. Sometimes more than one site in the same patient may be seen. Pathology, or you can say the mechanism of snoring. During sleep, muscles of the pharynx become relaxed during sleep and they cause partial obstruction. Then the breathing against obstruction causes vibrations of the soft palate, tonsillar pillars, and base of the tongue producing sound. Apnea during sleep will cause hypoxia and retention of carbon dioxide. This retained carbon dioxide causes stimulation of the respiratory center of the brain, leading to start of breathing. During sleep apnea, there are frequent arousals which cause sleep fragmentation, daytime sleepiness, and other consequences may result. Now, what is the effect of apnea on heart? Apnea during sleep leads to hypoxia and retention of carbon dioxide, leading to pulmonary constriction, which in turn may cause congestive cardiac failure, bradycardia, and cardiac hypoxia. Cardiac hypoxia may lead to left heart failure and cardiac arrhythmias, sometimes leading to sudden death. This is the flow chart in which you can see during sleep there is loss of air tone, and this loss of air tone will lead to airway obstruction, which will result in hypoxia, hypercapnia, and acidosis. Due to this change in biochemistry of the human being, there will be cardiovascular stresses. For example, The it will result in arrhythmias, systemic hypertension, chronic hypercapnia, pulmonary hypertension, and carpulmonale may result. And when there is hypoxia and hypercapnia acidosis, there will be arousal of the patient. There will be increase in air tone leading to patient patent airway, and this will cause again the patient will go into sleep. Similarly, when the patient is aroused during sleep, there will be this will happen for a lot of time during night, and it will cause fragmented sleep, which results in hypersomnolence and impaired cognition as well. So this is the all consequences due to this obstructive sleep apnea syndrome. In this figure photograph, you can see during sleep, gravity and muscle relaxation will allow the tongue and surrounding soft tissues to fall back into the throat area, obstructing the airflow. You can see, you know that the tongue is attached to the lower jaw, that is mandible. And when during sleep, especially in supine position, this tongue will fall, causing obstruction of the upper airway. Due to fall of the tongue, the patient will not be able to breathe properly. In this way, the patient will lead to other consequences of obstructive sleep apnea syndrome. Clinical features. A snorer with obstructive sleep apnea may present with excessive daytime sleepiness, snoring, morning headache, general fatigue, memory loss, irritability, depression, increased risk of accidents, and excessive loud snoring is socially disruptive and forms snoring spouse syndrome and is the cause of marital discord, sometimes leading to divorce. Complications or consequences as a result of obstructive sleep apnea syndrome. The patient may develop congestive heart failure or pulmonale. The patient may develop polycythemia, hypertension, cardiac arrhythmias, left heart failure, angina, snoring spouse syndrome leading to divorce, loss of memory, decreased libido, traffic accidents. This is the flow chart. This figure will show you due to obstructive sleep apnea syndrome, the patient may develop stroke due to high blood pressure. He may develop excessive tiredness. He may develop headaches. The patient may have increased insulin resistance even in non-diabetic patients. He may have migraines. He may have increased traffic and workplace accidents. Due to obstructive sleep apnea syndrome, the patient may have impotence and lack of sex drive. He may also have weight problems. Similarly, the patient may develop memory problems and inability to think correctly. He may develop gastroesophageal reflux disease and grinding and clenching of the teeth, and sometimes the patient of obstructive sleep apnea syndrome may develop cardiac problems such as abnormal heart rhythms, heart attack, and heart failure. All these consequences may be due to the obstructive sleep apnea syndrome. Diagnosis. Diagnosis is made by history of the symptoms and consequences, physical examination, and investigations. In physical examination, the first investigation is the body mass index. Body weight in kilogram divided by height in meter squared. Normal BMI is 18.5 to 24.9. The patient is said to be overweight when the BMI is 25 to 29, and the patient is said to have obesity when BMI is 30 to 34.9. Collar size. Neck circumference at the level of cricothyroid membrane is measured. Normal collar size in males is 42 centimeter, whereas normal collar size in females is 37.5 centimeter. Head and neck examination is also done for hypertrophy of palatine tonsils, to know the retrognathia, macroglossia, base of the tongue tumors, deflecting the septum, nasal polyps, and turbinate hypertrophy, etc. So, head and neck examination is mandatory to rule out all these possibilities which may be the cause of obstructive sleep apnea syndrome. Then systemic examination is also mandatory. Then Muller's maneuver, which is the reverse of Valsalva maneuver, and while the patient performs this Muller's maneuver, the CT scan of head and neck is done. Similarly, Muller's maneuver and flexible endoscopy may also be done. Last two these investigations will help to depict the potential level of upper respiratory tract obstruction. The last investigation is the polysomnography. This is the gold standard investigation. The patient is kept in sleep lab for a night and different parameters are measured. It includes EEG, electroencephalography, ECG, electrocardiography, EOG, electrooculography, EMG, electromyography. Similarly, pulse oximetry, nasal and oral airflow for episodes of apnea and hypopnea, sleep position, blood pressure, and esophageal pressures. All these are measured in polysomnography. This is sleep study, that is the polysomnography. This is a non-invasive procedure to diagnose sleep disorders. It records brain waves, oxygen level in the blood, heart rate, breathing, eye and leg movements. It also monitors the sleep stages and cycles to identify if or when the sleep patterns are disturbed and why. There are 4 to 6 sleep cycles in one night, each cycle lasting for 90 minutes. In this figure, a photograph, you can see how the sleep study setup is made. These the patient is connected to different electrodes which monitor and detect the airflow, snoring, brain activity, breathing movements, and muscle movements. Treatment. Treatment can be divided into two types. Number one is the conservative or medical treatment. The second is the surgical treatment. In conservative medical treatment, we advise the patient to change his lifestyle. For example, he should reduce his weight, he should avoid alcohol, and he should also avoid any sedative or hypnotic drugs. Second is the position therapy. The patient should lie on the side, on right or left side. He should not lie on the bed in supine position. The patient may be you may use a ball tied to the back of the patient because it will help to avoid the position during night. The patient will avoid to lie on the back. He should he would like to lie on the right or left side. In this way, the patient's snoring will be reduced and the patient will have less apnea attacks at night. Similarly, the patient can use intraoral devices, for example, MAD, mandible advancement device, and TRD, that is the tongue retaining device. All these will help to reduce the snoring at night during sleep. Second is the surgical treatment. The most important part of the surgical treatment is identify the cause and treat the cause. For example, if the patient is having hypertrophic tonsils, the patient should have tonsillectomy. Similarly, if the patient is having DNS, he should have septoplasty. And similarly, if the patient is having nasal polyps, then the patient should have nasal polypectomy. The patient may be offered permanent tracheostomy. He may be offered oropharyngeal surgery in the form of uvulopalatoplasty or UPPP, that is uvulopalatopharyngoplasty. And the last one is the advancement genioplasty with hyoid suspension. Thank you so much.